and Facebook Live. Just a minute. Okay, so we're here. A warm welcome to you all, students and faculty of VK Patil Medical College. We are very happy to have you all here to listen to this interesting discussion. And before waiting too long, I think we should start. And I think we all agree that our traditional eating habits stand the testimony of time, which saw rare incidences of lifestyle diseases amongst the Indian population. And perhaps we experienced illnesses more in the form of epidemics than chronic diseases like diabetes or obesity or hypertension and even depression. If we notice, our older generation was fitter and healthier, and they enjoyed good quality life and long lifespan. But this picture somehow changed with the advent of globalization and the introduction of Western eating habits. And today, the medical world has opened up to embrace dietary solutions, not just to cure diseases, but also to mitigate the devastating effects of climate change on our planet. And fortunately, today we have intelligent and awakened students like Pratiksha, who have realized the importance of diet in our daily lives and are willing to explore the world of food choices to heal patients and to make life much easier for doctors and patients. And in the current medical scenario, as you all know, the students hardly get to learn about diet or nutrition as a part of their curriculum. And unlike Pratiksha, many of the students are not yet aware of the new development in medicine, which of course existed since time immemorial, which will enable them to experience better and much more satisfying results while dealing with the patients. And hence, considering this picture, Jiva Bhavna has taken the opportunity to organize this exciting conversation between Pratiksha Bhansali. Uh, for those who don't know a bit about her, she's an intern from Vitthalrao Vikhe Patil Medical College in Ahmednagar, and Dr. Rupa Shah, who has completed her medical studies from Nair Hospital in Mumbai, and later on went to study lifestyle medicine from the Harvard Medical School in Boston, USA. And she later developed keen interest in natural healing therapies. That was about 3 decades ago. And she has been treating patients with the help of flower energy remedies, plant-based diet, and lifestyle and other complementary therapies. And she's been lecturing on this subject all over the world. So today we have deliberately kept this session very short and brief with the intention of introducing the subject to our audience, which mainly comprises medical students, but also for people who are curious about this subject, and of course the faculty of VK Patil School College, so that we have ample time for question and answers. But I'd like to inform you all that we'll be following up with a series of online events with various experts in the field of medicine to discuss about various diseases in much more details. So over to you, Pratiksha.
Okay, so good evening to all my teachers, my friends, relatives, and all those who came with intention of hearing this interesting lecture. Ma'am, I would like to start. First of all, we all know that India is the diabetic capital of the world, and for all those who are sick, tired, dealing with their diabetes, and because we have just heard about management of diabetes, our treatment of diabetes, we haven't heard for about a reversal of diabetes. And so for them, for all diabetic people, there's a ray of hope. And so Dr. Rupa ma'am, I would like if you start with the case about reversal of diabetes, where you tapered the anti-diabetic medicine doses and how you reverse the condition of the patient, please.
So thank you very much, Madhvi and Pratiksha, for inviting me today here. I would like to share my experience. I'm medical doctor for about 37 years now. And my father-in-law was also a doctor, and he was a diabetic patient, and he was taking insulin. And for years and years, we were thinking, how can we help him? And finally, 20 years ago, we lost him. And about 14 years ago, I attended a workshop where Dr. Nandita Shah mentioned about diabetes reversal. So I was very curious, what is this all about? And she just mentioned about a few cases of diabetes getting better by dietary changes. So next time I went for a full day workshop to listen to her, because that remained in my head that diabetes can be reversed completely. So once I attended it, I first time heard the word vegan or a plant-based diet. So I'm a vegetarian by birth. I take a lot of dairy products. At that time, I used to take. We are Jain and we take buttermilk and we do all those normal things like paneer and cheese and ice creams and rasagullas. They were all like in our house always. So I consumed all that. I said, let me try this 30-day experiment that she had asked me to, and see what happens. If I thought it was extreme to give up dairy products, and still I said, let me try because she's saying it. When I personally gave up all the dairy products for a 30-day experiment, I was in for a surprise. I had tremendous health benefits myself personally. I overcame my acidity and migraine headaches, which I used to suffer for 18 years, completely in a month's time. I lost a couple of kilo weight, my energy levels rose, and my face, started looking much clearer and younger. So I was very overwhelmed by just this one personal result where my migraine headaches completely ceased. So I said, what's wrong with dairy products? So I started studying all about it. And that's when 15 years ago, there was not much information on internet, but there were a few things available. Some books were available. Whatever was available, that I lay my hands on. And just in about a year's time, Dr. Nandita Shah invited Dr. Neil Bernard from USA. And he traveled across India and he was lecturing to various medical colleges about diabetes reversal. And then from him, I came to get this book from him, Reversal, Dr. Bernard's program for reversal of diabetes. So myself and Dr. Nandita Shah discussed about it. After Dr. Neil Bernard was gone, we looked at the diet plan that was given in the book, which was completely plant-based and whole foods. So we said, all right, let's just do it. How do we do it from Indian population? So whatever we had known at that time, we designed a program for a day, 1-day workshop, and all these stories came in some of the local newspaper, and we had like house full of diabetes patients. Like there were 60 people in the first workshop itself, and they were all diabetic. And we had this plan sorted out, Indianized from the book itself. And so said, we gave them breakfast, lunch, and also evening something to munch on. Everything was based on a plant-based diet. And then all the material, recipes, ideas we gave them. After 1 month, we had a follow-up with all those patients. So we had a follow-up meeting. Meanwhile, I was already following up some of them. And then Dr. Nandita came back after a month. And then we had all these people in the audience and the 3 cases that I completely remember was one patient gave up his diabetes medications in just 1 month. He had 2 tablets. There was one more who had diabetes for 10 years, gave up his medication in just the first month itself. There was one more who reduced his insulin. So I just can't forget these patients because they at least had diabetes for 10 years. And there was only 1 month, 30 days to give up the medication. And particularly this young boy that I remember, he was about 34, 35. And he was, going to gym very regularly, heavy into exercises. So like, it's not that he didn't exercise. He did everything right what a diabetes patient should do. He didn't take sugar. Like he followed everything, that our conventional medicine and our diet plans were giving him. But as soon as he followed the plant-based diet and lifestyle, the tablets were totally gone because his sugar started falling and it was reversed. And till today, I am in touch with one of the patients who reversed his diabetes about 13 years ago. He's still free of diabetes. He's now, I think, 73. So 13 years later, he still follows more or less plant-based diet and he has no diabetes. So this is like a bell, how can this be? We are doctors, we are spending 5.5 years of studies, then become endocrinologists, so much of medications, pharmacology, so much of complications of diabetes. There are thousands of us very busy managing diabetes patients. And how can they be simply reversed? Forget about managing, it's all about reversing it completely. And after that, we have not looked back. We started a complete movement in India with Dr. Nandita Shah. We did 21-day retreats, where what we did, first day when the patients came, we took their complete profile, blood test, everything, how many units of insulin, what tablets they were taking, if there were any other diseases. And then 21 days in the retreat, they ate organic, only whole food, plant-based diet. There was no oil, no sugar. And yet they were having grains and there were salads and a lot of other things, but it was only plant-based, no animal products. And I still again can't remember, there was one woman whose blood sugars were 500 and she was on insulin. Within 2 weeks, we had to stop her insulin completely. And that's it. Even till today, she's free of diabetes. There was another patient, we had to stop insulin in 3 weeks. And there were quite a few patients whom we had to just stop the medication, and quite many whom we had to reduce and then show them how to do this when they go back home. And then after that, there have been so many retreats that Dr. Nandita Shah has conducted. But we had Dr. Pramod Tripathi coming in the same retreat that we were there, myself and Dr. Nandita. He came in, he stayed there with us for 2 days, and he also looked at it. This is really happening, yeah? We say, yeah, it's happening. Just see, it's really happening. So he went back to Pune, and now he started the organization Freedom from Diabetes in Pune itself. And now they have the largest database in the world of type 2 diabetes reversed on a plant-based diet. And there are 4 international journals where he has published his data. And I have a video on my YouTube channel where all those links to those international papers are also given. He has 11,000 patients now who have reversed their diabetes completely through diet and lifestyle changes. Diet was always the whole food plant-based diet. So it's 10 years on, the movement is on. Now, every month he has new batches, thousands of people from more than 40 countries join in, and they are all having fantastic stories. In my own clinic, I have every month some fabulous results of some of the patients, and I just start smiling when they come. And they just give me a look, but my doctor never told me this. I've been taking medication for so many years. No doctor ever suggested this diet. So I said, because as medical students, even we are not taught this, we did not learn, we don't know much about nutrition. However, now the foundation of health should be good nutrition. And the plant-based diet is not just for diabetes. Pratiksha, on the way, blood pressure medicine, also we can stop. Obesity, one of the fastest one was lowering the cholesterol. Within a month, we could see drastic change in their cholesterol readings, and they don't need any more statins. So that and PCOS, yeah, there also we get results. Some of the thyroid also patients improve a lot. So this is now across the board, metabolic syndrome X, whatever comes under that is getting reversed with the whole food plant-based diet. So the answer is not in
Metabolic syndrome X.
the metabolic syndrome X is combination of various diseases that we label as lifestyle related diseases. It could be starting with obesity, high blood pressure, heart disease, diabetes, that's type 2, and there's PCOS and thyroid, bad lipid profile. So what I was trying to say, that the entry point can be any one of these diseases. To my patients, I explain, maybe you will put on 5 kilo weight for 5 years, you ignore, and then slowly hypertension gets in. Slowly cholesterol increases. After 10 or 20 years, they are taking a page full of prescription with blood thinners, everything included. एक डायबिटीज, एक बीपी का गोली है, एक कोलेस्ट्रॉल का है, एक ब्लड थिनर है. It's like a very typical kind of prescription that I see. So this whole thing is called as metabolic syndrome X, and that exactly is getting reversed on a whole food plant-based diet. Apart from that, there are also cases of autoimmune disorders. These also get better, and there are many other such cases whom, when some cancers have now been recorded, or some chronic kidney disease. One of the most important thing about diabetes reversal is the complications of diabetes. So complications could be retinopathy or nephro or your neuropathy. So we have now 7 doctors who are eye specialists, yeah, and they are now following plant-based diet and lifestyle. And to their patients, as soon as they see diabetic retinopathy, they catch hold of them and try to inspire them to go on a plant-based diet, and they see how beautifully they start healing. So this is happening now, and it's happening all over the world in a very big way.
Ma'am, so we can take a gist as more than exercise, a whole food plant-based diet has tremendous effect on reversal of diseases. Like if you choose between diet and exercise, your diet influences more. And one more thing, ma'am, when we talk about the concept of whole food plant-based diet or veganism, so many people think that it is very easier for Western people to do this because vegan products are very easily available there. So what is your view, and what will you tell Indians who ask these things, that how can Indians follow a whole food plant-based diet rich in nutrients? So please answer our question.
Very, very good question. Thank you for asking this. Now, let's not label it as vegan or anything like that. Let's say it's plant-based diet. So who are we? We are Indians. And what do we eat? We eat roti, sabji, dal, chawal. And that's plant-based, right? We already always eat roti, sabji, dal, chawal.
Yes, ma'am.
That's basic. A little bit of salad and mirchi and onion, something like that. So there's a big chunk of our population which is also poor, right? They cannot afford dairy products. They cannot afford eggs. They cannot afford milk and meat and fish, right? Or chicken.
Yes, ma'am.
So they are mostly plant-based. They rarely, like once a few times a year, they may have something, that is animal based. Most of the time they are plant based. And yet many of them can do a lot of hard work. And us, the financially comfortable families, we are the one which are having concept of milk and meat and eggs, and we push it, and we spend a lot of money to buy and start eating it. So eating simple foods that are plant-based like roti, sabji, dal, chawal, and salad is available all over India at a very, very cheap price. And that's being plant-based. That's that simple. You don't need
Yes,
a white liquid made from, say, almonds or soya. You just don't have to replace it anymore. You just have to eat these simple things, which anyway, a lot of other people anyway eat it. You don't need to
India,
buy
it is
any
more
products.
easily available.
Yeah, you don't need to buy
Yes.
any products, nothing. You just need to eat this simple food.
Okay. Ma'am, so we talked about, we can reverse diabetes. And ma'am, can you give us, can you elaborate about stroke rehabilitation, prevention first of all, and rehabilitation? It can be an ischemic stroke because of atherosclerosis, or blockages created in our blood vessels. And we know the complications of stroke as well, paralysis and all. Can you tell us about how you dealt with these patients who had stroke, and how you rehabilitated them, and how their health profiles, their lipid profiles, and overall, the quality of the blood vessels improved, and what kind of results they showed up, even in after severe situation?
Sure. So we are now focusing on, say, heart disease and the coronary artery disease, basically. So we definitely, I had one patient I remember who just had a heart attack. His troponin levels were very high, but he didn't want to go for angiography at all. And so he was sent to me by another doctor, and he was getting the pain all the time. So he was a hardcore non-veg eater. He was a shetty who would just eat, 4 eggs boiled every morning and lots of meat and hardly any vegetables. But he got ready to do plant-based diet. And when we put him on a plant-based diet, within weeks, he was walking normally. He started losing a lot of excess weight that he had. And all his medications, we had to stop at some point. And then later on, when he went for his test and everything, everything was clear, and he did actually his stress test, which also came totally normal. So it was very overwhelming that even at this stage we can help him to reverse his heart disease. But there is a chartered accountant here in Mumbai who had a bypass surgery. He was young at that time, and he had a bypass surgery. And post bypass, and when he had a bypass surgery, even at that time, he was like into running and everything, right? So he was already like an athlete, doing lots of things. And yet, like, he was shocked that how can he have this? So after that, he did a lot of research, and now it's been about 12 years that he's on a plant-based diet. He's one of the only long distance runner, and he's ran marathon all over the world, and he inspires people by this organization called as You Too Can Run. He's not on any medication at all. He even stopped his statins after some time, and he's on a plant-based diet, and he runs. It's amazing to see that, how people take action after even a disease has happened. There's a doctor, a intervention cardiologist in Chennai, who is a very famous one, Dr. Kalyan Sundaram. He is a plant-based doctor, and he's every day seeing, heart patients. Every single day, he's so busy putting stents and everything. And as soon as it's possible, he wants to inspire his patient that you don't want to go through this again. Then you listen to what I'm saying. It's okay, right now you had it, but now I can help you and prevent it so that there will be no further episodes. Similar thing happens in the stroke patients, because instead of taking blood thinners, the plant-based diet itself keeps your blood thin. So you don't need any medication, and the possibility of getting a stroke will be much, much lesser.
Okay. Ma'am, we talked about, reducing dairy products overall, and all animal-based food products. But there are many pregnant ladies who fear going on a whole food plant-based diet, thinking, what about B12? And because they have heard that folic acid and vitamin B12 is necessary for the neural development of their babies also, and in pregnancy it is beneficial for them also. So how would you advise or advocate a role of whole food plant-based diet in those ladies? And, how can we give them confidence about following a whole food plant-based diet and having a healthy pregnancy, even a better pregnancy?
Sure. So obviously, we have to take special care of nutrition during the pregnancy time. We take care of B12, folic acid, and D through supplements. That's for sure. If required, of course, iron and calcium supplements, only if required. Most of the time, they are not required. However, B12 is definitely required, so we supplement. And also the D, if sunshine is not available, and these days across the board we see population is very D deficient. So these things are definitely taken care through supplement. Now, rest of the thing about getting the complete nutrition for the baby and making her pregnancy go through very smoothly is very much possible on the whole food plant-based diet. That is the time when the relatives and dear ones start forcing you for having ghee and doodh, and otherwise baby will not get it. But now there are vegan moms all over the world. There are also some wonderful vegan moms here right in Mumbai, and we had a nice conversation with them. There's a Facebook group for those vegan moms who want support and need more detailed information about nutrition during pregnancy. But they choose to have a vegan pregnancy. They are totally on a plant-based diet. They have, in fact, very less troubles during the pregnancy. The babies of normal weight and very intelligent, and in their children are now plant-based also. So I know quite a few children who are like maybe 15, 20, all throughout they are just plant-based, and their parents also, totally plant-based. So I suggest that we can do this in detail at some other point, but it is possible. It's already happening, and it's happening all over the world. People are choosing to go plant-based, and there's absolutely no deficiency of any kind.
I would like to add to your statement. There are vegan B12 supplements available, which of course, ma'am, it can be more healthy than the taking B12 from animal source, because now, as you told us in previous session, that animals are themselves injected with supplements of vitamin B12. So why can't we ourselves have vegan B12 supplements, and we also get B12 fortified yeast and mushrooms, which are healthy, of course. Ma'am, adding to it more, like we talked about pregnancy, and now there comes a time when the lady is already pregnant, she gave birth to a baby, and the mother's milk is of course healthy for the baby for 6 months, and that's why we advise exclusive breastfeeding for 6 months. But when there's there comes the time of weaning, like shifting from mother's milk to the normal diet. So how can a whole food plant-based diet be healthy for the infant? Because all parents are very anxious, and no, my child should drink milk, and we have always seen advertises and everything about mothers running with a glass of milk behind us, and even our moms, because of ignorance or whatever, they have ran behind us taking the glass of milk. And what role, or how can we make our infants healthy through whole food plant-based diet, and by not giving them dairy products?
Correct. So the most important that there is in nature, you don't see one species baby drinking the milk from another species. Only humans have been looking at animals, and if it's white color liquid, they think that's their replacement and they can have it. So anyway, the composition of the dairy, say coming from cow or a buffalo, is exactly suitable for the calf, for the development and the growth of the calf. It has the hormones also exactly suitable for the growth. So we as a humans, if we start taking that kind of milk, then we also have to start responding to the protein, fat, and even the hormone content in that particular milk. And then there are also other factors like antibiotics and also pesticides. Also milk travels long distances, so all those also comes along. Also the composition is much higher than the human baby's requirement. Human baby triples the weight in the first year of life, and that's when mother gets milk. The growth is very fast. The brain also growth happens in the first year, and that's when the first year of life mother's milk is the best. After that, you do not have to take milk from any other species. So of course, again, this is an Indian concept that moms would immediately want to replace it. So the plant-based diet is actually superior in content, and also it is more bioavailable. Calcium or whatever needs are there is there in the plant-based sources, and it's also more bioavailable than actually dairy products. And these days I see that many pediatricians are aware that there is lactose intolerance, and they probably stop advising children for dairy. So I recommend that as soon as the weaning happens, you just put them on a regular diet as what is eaten in the household. And after a year or so, they should be pretty much eating a lot of things. But there is no deficiency in the plant-based diet at all. There is sufficient protein, whatever is required for the growth. There's sufficient calcium.
Okay, so ma'am, whatever we have read in our traditional Indian texts about giving, slightly starting weaning with smashed potato or banana, or peach, healthy peach made of rice, which we give. So that is, of course, healthy, and we do not need milk first. That is what you mean.
Also,
Ma'am, now I would
very
also like
poor.
to.
Yeah, Pratiksha, very poor people cannot afford milk. They don't have money for food. Where will they buy milk? So I asked my bai, and she said that when her children were young, she used to just make multi-grain porridge and just give it to her children after she stopped breastfeeding her. So that's it. Like there are replacements of this kind, and children look very healthy. So there's no problem at all to replace it with such products.
Ma'am, I think we are having lack of time, but still I would like to ask two more questions, and I would then like to give over to Dr. Mrs. Madhavi, ma'am. Ma'am, we talk about asthma in children nowadays. We are seeing childhood asthma, and it is. I read many research papers myself. It was correlated to dairy products. I also read that milk, the uh, European Union, like suppose, like if we talk about dairy products in Europe, okay, we can think that because of economy, good economy of Europe, they have good standard regulation policies for the quality of milk. Let us suppose, like whatever milk they export, they look to it that the milk is pure as possible. But I read that even European Union, like because the dairy cows, they have mastitis, infection of the udders of the mammary glands, so when they are infected, and so to avoid that infection, we give antibiotics to the animals. And so there is a risk of antibiotic resistance. I would like you to elaborate on that. And moreover, these animals, when they give milk, of course, that pus enters the milk. And I heard that European Union itself permits 2 million pus cells per just 1 teaspoon of milk. It permits. So, 4 lakh pus cells per liter of milk, 2 million pus cells per teaspoon of milk. So it is dangerous. And I think, of course, that might be, a trigger for asthma in children, for infection in children. So, you know, can we reverse asthma in children through not taking dairy products? And, what else would you recommend for children to not have asthma? Ma'am, please elaborate on this asthma, allergic rhinitis, or atopy, or allergies in children, and correlation with dairy products or animal based.
Correct. So, the huge, almost 75% of the pharmaceutical drugs that are produced in the world are actually used for animal agriculture. So that includes also dairy industry. The meat industry is also using huge quantum of antibiotics because they are kept in very big space, campuses where they are, very much in close
Crowded.
proximity and in a very unhygienic condition. Even if they keep them in hygienic condition, their immune system goes down, then they are given repeated antibiotics. And these antibiotics are in the meat or also in the milk. So we are exposed to antibiotics if we take dairy products, and the bacteria can go resistant. However, from say Ayurvedic point of view, also milk is kaphajanya. It produces the mucus in the body. So whenever small
And we, of
children,
course, have two Ayurvedic doctors with us, Dr. Veena and Dr. Aishwarya. So even, they would like to hear you. Ma'am, please continue.
correct. So milk is kaphajanya. It is mucus forming, and as soon as the cold and cough and nose blocked, and also tonsillitis, and also ear pain, ear block, and upper respiratory tract infections, and also asthma, all of them are getting linked with the dairy products. As soon as you stop dairy products, the sinusitis clears up. Many of these children, have tremendous improvement in their asthma also. So that's why many pediatricians are now, paying attention that they may be lactose intolerant. Also, we do not have the enzyme, the lactase after a certain age to digest milk. So that is also another additional factor that the milk may become now, mucus forming. But also, I would just put it simply that anything that's not our food is going to cause some reaction in our body, and our body will spend more energy actually trying to digest or process it. The food should give us energy and not take away our energy. Food should nurture us and not make us sick. So that is the demarcation. The plant-based diets are very easy, simple to digest. There should be minimally processed, and that suits our anatomy and our physiology. Anything else that is made in, say, big plants or factories, yeah, or neatly packaged, highly processed, all these foods are actually looking like food. They are only food-like substances. And though they don't nurture us, they actually drain us and they make us sick. Even things like food colors and food preservations, all these, you know this, the food industry has got away with all these things, but in the long run these are not good for us. Once in a while you ate something, your body will process. I also know many children who are sensitive to food colors, and I have to stop them all food color items, and then their asthma improves. So really we have manipulated our food far too much, and the farmers, food industry, FDA, the drug industry, and doctors, we all need to talk to each other and then come to a common solution for a healthy planet. Otherwise, we will all work in various departments. One will create disease, the other will be busy, treating the patients. And that's what is the scene right now.
Ma'am, I would also like to talk about the autoimmune diseases, like we talk about systemic lupus erythematosus, and or inflammatory bowel disease. And we have recently heard an article of Dr. Brooke Goldner, MD, and he said she wrote a book by autoimmune diseases. So, can in Indian population, can we reverse these autoimmune diseases through whole food plant? Like some people think, okay, it can reverse diabetes, hypertension, or all these non-communicable diseases. But what about autoimmune diseases? So can we reverse that through whole food plant-based diet? And adding on to this, ma'am, this last question, uh, you know, recently we had an epidemic of COVID. So somehow we understood that it is SARS, severe acute respiratory syndrome, and it was prevalent, like it was common in animals like cats, dogs, or camels. So it was common in them, but because we have intruded so much, in the natural environment, we are cutting down trees, we are cutting down forests, we are having animals as our diet. And in China, I don't need to mention, they don't spare even one animal to have them, that animal in their diet. And so if you're yourself exposed to all these toxins through your food, definitely it will cause an epidemic. So what is the correlation of animal based diet and COVID infection, and the role of whole food plant based diet in it? And I would like you to correlate both these COVID epidemic as well as autoimmune diseases with whole food plant based diet.
So there is a particular video by Dr. Michael Greger, who's written this fantastic book called as How Not to Die. And in this, he has mentioned all these various diseases that can be treated with a plant-based diet. Now, Dr. Michael Greger's one video, which was probably released 10 years ahead of time, where he mentions that in last 100 years, all the various epidemics and pandemics happened had a link with some animal. And it was the crossover from an animal. The animals are safe in their wild habitat. Only the day human being thinks that I can eat or I can do something with this animal, there's a close proximity of humans and animals. Now the various exposure happens, and then we are succumbing to the pandemic. The second study that I would like to mention is about, there was a study during this COVID time done, and they found that 73% of lower risk in those who are plant-based diet, those who are following plant-based diet, they had 73% lower risk of getting severe to moderate COVID. So this was very interesting that plant-based diet is also protecting you to some extent. So in the case of autoimmune disorders, there's a breakdown of the immune system, and this happens along with the animal proteins that are coming and passing over into the blood through our gut, and our body identifying it and then trying to produce antibodies. And then these proteins sometimes are similar to some of our organs in the body. They go and sit on the cell membrane, and the antibodies end up destroying our own cells. And that's how the type 1 diabetes comes about. So the most important one, at least eliminate all the animal sources. All the food that comes from animal source, proteins particularly, eliminate them for autoimmune diseases. That will decrease the load on the system, and then see what is left and how can we build up the system all over again. The the plant-based diets, and particularly if they are organic, then they are far more beneficial. Nowadays we also have problem of pesticides and fertilizers. Obviously we will have to overcome that as well, but then there are toxins that are fat soluble, which are in the animal's body, and then there are toxins and chemicals which are in the water soluble base, that is in the plants. So at least they are plant based chemicals can be easily handled by the body, but the animal based chemicals coming through the animal food, they get stored in the body and they are far more harmful. Also about the dairy products, I just wanted to say one more thing. Earlier we used to have deshi cow, and it was A2 cow, and she was not artificially impregnated. She was not pumped in with a lot of hormones and antibiotics. That time our ancestors could drink milk or have curd or makhan or ghee, whatever, and they were still fine. But now we have a lot of this A1 Jersey cow. Almost 90% of them are, and they are linked with many diseases. So that's the one of the biggest reason why we also have this now metabolic syndrome X explosion.
I would like to mention that we also had Colonel Dr. Khandelwal with us, and our Vice Principal Dr. Kalu sir joined few minutes ago, but he left maybe because of reasons. He himself is vegan, and he lost 14 kgs weight through it. So it's a big inspiration for all students in our college.
Awesome.
And ma'am, yes, I would now like to hand over to Mrs. Madhvi Kolte. And ma'am, through her or in the discussion you have, please let us know about the effects we are having, planetary health and personal health, how it is correlated, the soil, all those things which we are doing in the environment. We are growing more livestock to having, for meeting our increased number of milk and, food which is not even healthy. It is harming the environment, it is harming us. Uh, it is of course harming the poor innocent animals. So please have a discussion. Ma'am, over to you, Mrs. Madhuri, ma'am.
Yeah, Pratiksha, I think you've already conveyed the question. This was on behalf of Jiva Bhavna because we're an organization that works and studies the effects of animal agriculture on public health and the environment, especially in India. And I think Pratiksha has conveyed the question. Dr. Rupa, you can go ahead and answer the question.
Sure. So, everything starts from the soil. I always say, what is the food of your food? If your food is given pesticides and chemicals, it's going to get into your food and then you are going to eat it. Same way, what an animal is fed, that will go also in the animal's body and then you are going to eat it. So that is whatever we do to our environment, it's going to become part of us. The air that we breathe, in just few seconds, it becomes the part of us. The water that we drink also on the planet, whatever is the water, is going to become the part of us. So we are not separate from the whole universe. We are totally connected. And whatever we do to our environment is only doing harm to ourselves. We can never separate ourselves. You have animal agriculture, you have big factory farms, and you have thousands of animals kept over there. Their poo is creating a lot of methane and nitrogen, and the poo is collected, and they are like one of the biggest disease factories. You don't know how to dispose them, and then you think you're just going to have neatly packed a burger and not having any connections made. So we'll have to ask the questions about the environmental resources. We have limited environmental resources, and more of it is getting diverted to, for animal farming, agricultural practices. And because of that, there is a huge wastage. The planet is on the edge now. And because of that, the climate also is changing. Because of that, water is changing. Because of that, air is changing. And we think that a kilo of meat, is going to use far more water than a kilo of plant-based food. So there's so much of difference. It's almost like, many times people can be fed if the whole planet became plant-based rather than animal-based. We'll have to preserve our planet by leaving the animals back to where they belong. And you are going to kill them, you're going to eat them, you think you are going to get protein or something. Your body actually has to cut down all the protein into various amino acids and then make up another protein for your own use. You are actually wasting your energy. When you take protein from the plant-based sources, it's just direct amino acids. You make a protein that you like. It's not draining, energy. So we'll have to rethink just for our taste buds, just for some concept. We are doing this. It's going to harm our environment, and it's not sustainable for our planet. Neither it's sustainable for our own health as well. In the long run, we are going to damage only ourselves, and more pandemics will come, and the pandemics themselves are a huge burden on our entire healthcare system. So there is already epidemic of cancer, epidemic of heart diseases, epidemic of obesity. It's actually pandemic, actually these are like everywhere. And now we have also this kind of infectious diseases. So it's a drain on the health of the planet and health of the individual. They are totally same. It's the same topic.
Thank you, Dr. Rupa. That was very insightful. And I'd like to tell our audience that especially we asked Dr. Rupa to speak about this because today we are in the midst of a climate catastrophe where we are seeing the effects of climate change in a very big way. I think none of us can deny what's happening. And Jiva Bhavna is a solution-based organization, and we are running a program especially for farmers because the question of livelihoods of farmers occurs. And Dr. Rupa Shah just mentioned to us that the best way to give ourselves healthy food, good nourishment, is eating naturally grown food. And this is what we're doing with our farmers. We are working with them to produce naturally grown food so that they also come out of this system which has kept them locked in the animal-based agricultural practices. And also the citizens get access to naturally grown food. It's called Urvarasa, the project, and I'll share the link in the chat. Yeah.
Ma'am, how can individuals get access to the natural food you talked about, and how you're supporting farmers in it? And how can we individuals support the farmers by just buying the naturally grown food?
Yes. We are running a pilot project right now in Pandharpur with one farmer who is, in the process of growing naturally grown food. And we would like to connect our consumers with the farmer directly so that they get to know their farmer and they are assured of the quality of the food and that it is natural in the true sense. And because of this, the farmer will get the right compensation for the hard work he's doing on the farms. And again, because natural farming is not supported by the government in the form of subsidies, the way it's doing for animals, if people buy food from such farmers at the right price, he will be made economically secure. And that's what a struggle is today, to become economically secure and independent in his farming practices. So he's not dependent on the loans because of which farmers are committing suicide, especially. And he's able to live a respectable life and feed his family and meet his basic needs. And again, most importantly, people are in need of nutritionally dense food. And it can only happen when we have more and more farmers whom we support and we encourage them to participate in projects like Urvarasa, which are run by Jiva Bhavna. So I will share the link in the chat and you all can later have a look. I think Julie has something to say. Yeah, so Julie, the questions which were asked, I think they're covered. Is there anything specifically you want to ask? Because the planet, Dr. Rupa Shah has mentioned about the climate effects on the planet and probably about biodiversity and soil health. Would you like to talk more, Dr. Rupa Shah?
Yes. I was just going to use a word that we have to think about tomorrow, today. Is that so? It's so important that we must think about tomorrow today, because tomorrow is not there. We've already destroyed it. If we don't pay attention, it's not there anymore. The soil cannot sustain itself with all those fertilizers, making it so acidic and full of dry soil. What is the life? What do we do when we use the pesticides and we are destroying the very life in the soil itself? There is a microbiome. There are bacteria that do a lot of work over there. There's living beings over there. What are we doing? We're just killing them. We're just forgetting that they're so important for us. They have to be there. They are the ones that are doing most of the work while the farming is happening, while the food is getting prepared for us. So we just kind of just don't focus on them. We just use all these chemicals. We just spray them with whatever we like. And when you destroy the life on the earth itself, the earth is like a living being. The earth is giving us the life. You have to honor. If you destroy the soil, where will you go? So it starts really by paying attention to live and let live, which starts right from the earth. That should be a living being. It should be thriving with a very healthy microbiome. That actually does a lot of work at the root level for the plantation to happen. If you have a very strong microbiome, then the plants will also have a very strong immune system. They will not fall prey to so many pests. You will not need to use so much of chemicals, and you will have more or less, very healthy food to eat. You regenerate the microbiome in your own intestine as well, because now you are not taking food which is so chemicalized or has so much of all this antibiotics or pesticide that destroys the microbiome in our own body. So about 70% of our human microbiome at the moment is already destroyed because of the overuse of all this short-sighted thinking that we have and destroying, all this. So we'll have to start right from the soil health, preserve the microbiome. Remember how the earthworms are so important right over there, and also all this bacteria that keep the soil alive and make it so nutrient rich. Then you grow the food which is in harmony. You don't need much of this stuff like chemicalized stuff. You can use a lot of natural stuff to sustain it. You eat it, food which is rich in nutrient, your body can absorb it, and it also should help restore the microbiome in our own gut, which strengthens our immune system. Remember, it strengthens our immune system, and then we do not hopefully need so much of drugs or vaccines. We don't want to be a pharmaceutical dependent society or a vaccine dependent society. We want to return to a state when our body has this inner doctor that always looks after, always heals, always has figured out everything properly. And it always actually does try to heal. And only when we make major mistakes, it just gives up and says, okay, now I can't handle, you got the disease, you got diabetes, I can't handle the sugar anymore. So also the mind and emotions also get affected by the food you eat. So animals, when they are dying, there is a release of adrenaline, and that goes into the meat. When your body, you eat that meat, your body gets also the dose of the hormones, and it interprets as a shock or death-like situation or a stress. And in our mind also, it gets translated as stress. So in this time, we are supposed to be a very healthy society. We have highest number of psychiatric drugs in use because people are becoming depressed and very sad and also very stressed out. So now just making a link right all the way to the meat, and what are you feeding them? The food of your food or your food. What is the package whole about? Is it the package about life, or is it package about death? The plant-based foods are all living foods, have much deeper impact also on our mind and emotions. So we just talked about a lot of physical conditions, but I have had many patients when they go on a plant-based diet, we have nicely reduced their psychiatric medicines also, because the depression goes away, the sadness goes away. And often it comes, from all these hormones from an animal's body. So I think this is what I would like to share, that as medical students or as doctors, we are taught the management of disease. We know how to prescribe. We manage a disease, but we do not look for the root cause of the disease. We, as a good doctor, would like to look at the disease, where it comes from, remove the cause, and the disease will go away. And that's a better way of treating a patient, and that's a better doctor who empowers his patient with knowledge of remaining healthy, becoming healthy, and it's a less burden on our entire healthcare system. Right now in the COVID time, you saw that our healthcare system literally broke down. People were on their own then, just, whatever may happen, may happen. We don't want all those things. If we can have a larger population now following plant-based diet, we will have a very less burden on our healthcare system. Right now, diabetes is one of the most expensive disease, because slowly, sweetly, over period of 30-35 years, you go to insulin finally, so many complications, dialysis, transplant, very expensive. It's a burden on the system.
Okay. Ma'am,
So,
I would
Rupa,
like to ask the
go ahead, Pratiksha, go ahead.
ma'am, I would like to ask the audience that if you have any doubts, you can ask 2 to 3 questions. We would like to satisfy ourselves by the knowledge that we are having
Hello,
from Rupa Shah.
Pratiksha.
And ma'am, okay. Yes, sir, yes, sir. Ma'am,
Just I
Dr.
have one
Abhijit
question.
Awari, he's a professor from microbiology. Yes,
Yeah,
please.
just I want to ask one question. Now, the very first speaker, she said that it should be oil-free and sugar-free. Now, is it possible?
No, not necessarily oil free or the sugar free, because sugar also comes from the plant and
Yeah.
oil also comes from the plants.
Yes.
But when you have diabetes, there are two reasons that we have found out. One of the most important one is unhealthy fats in the diet.
Yes.
So, as a medical doctor, we are taught that the sugar is the cause. No, sugar is not the cause. Carbs are not the cause. It is the other way around, unhealthy fat that gets inside the cells. We call it as intramyocellular fat,
Yes.
which increases the insulin resistance. So
Yes.
our focus should be on releasing these unhealthy fats from the system by first stopping it from outside. So that is why for those who are in diabetes reversal, we inspire them to not to take refined oil, maybe a little bit of cold press oil, but the oil with fiber is always good. If you have peanuts, it's better than have peanut oil. So because both are plant-based. So we try not to have processed food. But once you have reversed your disease, you should be able to have some oil. There's no problem at all. But even the sugar, white sugar, you don't want to have, but you can have jaggery. And there are, we do GTT test after a year or so. When the HbA1c comes back to 5.5 or 6, you reverse your diabetes. We do GTT test of some of the patients. And when they pass the GTT test, now we say that now you are out of diabetes. So this is completing the cycle. And then you can probably have oil here and there once in a while. There is no problem. Even your body should be able to handle some amount of white sugar.
Yes, ma'am. What about paneer?
Paneer also comes from the dairy, right? Dairy. So
because just why I'm asking for myself, because my cholesterol levels are not coming down.
Yeah.
So that is my problem. So I don't know what to do. I have tried all sort of this thing. So lastly, I'm asking you what to do now to bring down the cholesterol.
So best is to go on a plant-based diet, whole food plant-based. That means minimally processed. And you exactly know your cholesterol numbers now, exactly. And then for exactly 30 days, you do completely plant-based. That is like, say, morning you have herbal tea instead of chai or coffee.
Yes.
Okay,
Yes.
so there's no dairy, there's no sugar. Jaggery powder can be added. Then you have your breakfast, usually dalia upma or uttappa or idli. All these things are allowed, or a chila. Then you can have a fruit sometime around 11:30 or so. Then later on, you add a bowl of salad. And after half an hour or 1 hour of that, you can have proper roti sabji and a dal. So that is good enough. We usually inspire 1 grain at a time. If you have roti, then you don't have rice. And then later on at around 4:35, again, don't have chai, don't try and eat anything, maybe some peanuts and chana will do, or a herbal tea, and straight away have your dinner at around 7:30, which can be anything like pulao or khichdi and soup and pulao, or even once in a while you can have whole wheat bread also. So here we are not having dahi, we are not having paneer, we are not having any animal products. And this oil that is to be used is just like 1 teaspoon, that will do. Try not to use refined. And then check your cholesterol level exactly after a month of it.
Okay.
Yes. So for Dr. Avari, sir, I would also like to say that we have alternatives, like we have tofu made from soya. So there is a difference between whole food plant-based diet.
Actually, my problem is that my problem is I like to eat outside. That is my biggest problem.
Yes, so we have a good option in Shirdi. We have Compassion Cafe. If you go to Shirdi, we have a hotel which makes products, animal-based products, and they are tasty too. All whole food animal-based hotel. But of course, having pulses, food which we have it at home is always healthy. But if you want to suffice your cravings, we can go to you can go to Shady, and there is you can get burgers and all this. To have a shift towards plant-based diet, basically, to have a shift towards it, we can try healthy alternatives that is tasty.
And which oil she said, no, ma'am? So
yes,
I'm actually driving, so I'm not able to hear properly.
Okay.
Which oil, madam?
Ma'am, which oil? Yes.
So Abhijit, the oil that is, I usually recommend groundnut oil, which is cold pressed. Kachi dhani ka, in case if you need to use, you just use
actually,
that.
Madam, I have taken for 3 months ghani ka tel oil, and then my cholesterol level again rose. So
but
I don't know.
Yeah, but we have to eliminate animal products. Don't have eggs. Okay.
No, I am a vegetarian mainly, but I eat only egg white. That's all. Sometimes, not always.
Even egg whites, no. Just don't take that part also, and don't take any dairy products. Don't take paneer. Don't take refined oil. Outside fried food will have some cheap palm oil. That is going to be a trouble on our cholesterol level.
Yes.
Ma'am, I would like to mention that Dr. Avari is a very enthusiastic doctor professor from our college, and through him, the things which he experienced, he also contributed a lot in our hospital during COVID times. He is an inspiration for students too. So through his transition, I'm sure he will be encouraging all of us as well.
No, but I just want to add one thing. Pratiksha is also an enthusiastic student, and she was also actually we were. She also brought us to go for some bigger projects. We had some projects of outside our institution. So because of her theme and her thinking, we went there and we did the project in prostitutes for assessment of our HIV status and the STD status in prostitutes. So I am very much thankful to Pratiksha for organizing this such a beautiful webinar, right? So Pratiksha, I will be inviting you for my department tomorrow or sometime, because I have to discuss more things about diet only. Okay?
Yes, sir. Through Dr. Rupa Shah's guidance, and yes, sir, no problem.
I'm thankful to all of the speakers here. Beautifully, they have explained everything, right?
Thank you, sir.
Really, we should take the inspiration from them. And Pratiksha, I'm going to call you in the department for just time to discuss the things. Okay? Just now, I'm traveling now.
Thank you, sir. My pleasure. Yes, sir, no problem.
So basically, like to everyone, I want to inspire that it is before prescription, before you take your pen and pad and want to write a prescription, think about it. Drugs are not the answer. They are the last thing. First, we must find out where can I change my lifestyle and diet, and can I handle it? If we can, then I think it will be the great thing. Very few people will then come for prescription.
Yes, ma'am. Definitely, ma'am.
Thank you.
Thank you. Thank you.
Over to you, Madhuri, ma'am.
Yeah, thank you, Abhijit sir, for joining us, and we look forward to more interactions with you. Yes. Any more questions by anybody?
Sudesh here.
Yes, Sudesh.
I have a question for Dr. Rupa Shah. Somebody who has just gone diabetic, can they consume fruits like bananas and mangoes?
Yes. In fact, all our patients who are on a whole food plant-based diet, They, through the mango season, they have mango every day. They have bananas, pineapple, watermelon, chiku. So it's amazing. They get overwhelmed. There are patients who tell me, "अरे मैंने 10 साल तक ये खाया नहीं, वो खाया नहीं, ये fruit नहीं खाया, mango नहीं खाया." So I show them the way forward. They do eat all these fruits and the sugar does not increase, because the most important unhealthy fats in the diet that comes from animal origin, those are eliminated. Then in a plant-based diet, we try not to use more refined stuff. Then these two key, very important, the sugar starts coming down. The stories that I told you right in the beginning, it's like for a doctor to see, it's overwhelming, you know, somebody getting better in 1 month, 2 months. I had a patient who had 40 units of insulin taken for 14 years, went away in 3 weeks, and is just now on some medication. So they are overwhelmed. Even I am overwhelmed with so much of suffering. Simple diet changes and the life, you know, gets so much better. So we do have to keep open mind. Borderline diabetes can be reversed very fast. Within a month, you will see that the sugar levels will be very good and HbA1c will come back to 5.5 in about 3 to 4 or 5 months time. You will see it is dropping every month. That's so beautiful to see that how your body responds moment you put the right food in it.
Oh, thank you, Doctor.
Any more doubts anyone has?
I had another question. Recently, my mother got diagnosed with diabetes, and she had fasting glucose levels very high than the non-fasting ones. What do you call it? I don't know what you call it.
A PP, post lunch.
Yeah,
So,
exactly.
yeah, so you know, before even diabetes develops, first is a little bit of extra weight. Sometimes there's no extra weight, but there is a insulin resistance. For 1 or 2 or 3 years, the insulin that is produced by your pancreas is much higher, and it tries to compensate. And when it cannot, then the first diabetes, you know, gets diagnosed. Until then, the blood sugars are maintained. Now, so 3 years already something has gone on, and now there is blood sugar higher. So we'll have to work on insulin resistance part of it, which is done through plant-based diet very beautifully. And the body's capacity to produce insulin just sufficient for our daily needs will be restored back. So just ask her to go on this, and she should definitely improve and continue to follow it for almost rest of her life as much as she can. Then she will not get diabetes back again. And that is the biggest gift we can give someone, the freedom from disease, freedom from diabetes. So you can grow old and you will still not have the same diseases as the colleagues of your age have.
Thank you. I'll try to
Thank you, ma'am. Ma'am, I would like to mention that Dr. Nitin Shurore, very hardworking and honest physician from our village, he has also joined the meeting. Thank you, sir, for joining our meeting and attending it. Ma'am, last question for my friends, all medical students. Ma'am, you mentioned about some university course about nutrition in our Pune University. Ma'am, can you tell us about the course so that all those for whom it is possible to attend the course, they can attend it? And then over to you, Madhuri, ma'am.
Not actually for doctors. We have done one right now at SNDT University for those who are BSc and MSc nutritionist. So there is a plant-based nutrition course for them and for disease reversal. And hopefully we want to plan out one for doctors also. With the same college we will do. Doctors don't have much knowledge on nutrition. The endocrinologist prescribes medicine, and then he says the diet will be given by my dietitian. So doctors are like, it's not their department, they think. But that's not how doctors should get educated and learn about it. They may not in future give it, but if they implement in their own life, that's good enough. And in future, we can help our patients also by having a nutritionist who is very knowledgeable on this subject.
Yes, ma'am. Thank you. So, ma'am, basically, whenever a patient comes, you always ask doctors, what should I eat? And I think through today's session, you have very well answered our doubts. So, as doctors, as medical students, we know how to handle emergencies, medical emergencies, or we know the mechanism of drugs, what happens in your body. But, very rare times we know how our food influences, and rarely we know, like Dr. Rupa Shah mentioned, we don't know about nutrition more. We know about medicines, we know how to handle emergency cases when we, of course, specialize in various sections. But, for overall lifestyle and reversal of communicable diseases, Dr. Rupa ma'am has guided about the role of whole food plant-based diet. I would also like to mention that by eating animal-based foods, we not only harm innocent animals, we kill them for our food, we exploit cows for our milk, but because of livestock sector, the pollution that these animal industries are creating, and the methane gases produced from livestock sector, cows, cattle, the methane gas, which is a greenhouse gas, it is causing global warming. 51% of human caused climate change is because of livestock sector and animal husbandries, and because we have animals in our plate, so we are the culprit. So just through our food, how can we be healthy, and how we can influence, how we can improve our environment? That is all we personally can do. Thank you, ma'am. Over to you, Madhavi, ma'am.
You're absolutely right, Pratiksha. And again, I'll repeat, especially because doctors are the ones who are taking care of people's health, and especially because we are in the midst of the climate crisis, doctors now have the onus of knowing what is happening with our climate and giving the solution by healing the patients physically, as well as providing an environment which will be more conducive to thrive on this planet. So we hope to have continue with the discussion, and I'd like to thank both of you on behalf of Jiva Bhavna for having such an engaging discussion. I hope many people benefit from this talk. We'll share it on our YouTube channel as well, and share it on other social media channels after this event is over. But let's keep this dialogue on. And yes, thank you again. We're very grateful to everybody who's participated here, and Dr. Rupa Shah and Pratiksha. You have your exams and still you decided to do this. So keep up your good work.
Thank you,
and you will be a change maker in the medical fraternity. Yes.
Thank you, ma'am.
Thank you for having me.
Yeah.
Thank you.
Thank you.
Thank you.
Ma'am, should we end this session now?
Yeah, we can end the session. I'll stop the recording.
Okay.